Positive effects of clinical decision support systems have been discussed and compiled by Mandy Rogers, Callie Woodring, and Taylor Lindley. Please join us as we discuss the effectiveness of clinical decision support systems, or CDSS, in the healthcare field. Clinical decision support systems are positively effective on patient safety, quality of patient care, and economically. CDSS are effective on patient safety. Research shows that improved clinical outcomes are shown in patients due to an alert from CDSS based on patient history, family history, and allergies, as seen by Campbell in 2016. Alerts provide safeguards to prevent contraindicated prescriptions and treatments that may result from medical errors that could lead to adverse effects. A clinical example from a study at Fletcher Allen Healthcare in Vermont that implemented CDSS provided a 60% decrease in near-miss medication error, leading to increased patient safety from adverse drug effects, according to Bell and Thornton. HealthIT.gov implies that reminders from CDSS for current behavioral risk factors or family history risk factors for preventative measures of treatment are impactful for patient safety. Campbell relays the story of how CDSS was successful in providing patient safety to deter a fatal outcome. The story is of a 75-year-old male who was ordered for the first time a colonoscopy that provided results of a cancerous tumor with his colon. That led to successful chemotherapy. CDSS alerted a family history that had never been approached due to paper charting to integrate diagnostic testing for observational measures that, in this case, led to improved patient outcome after diagnosis and treatment. Campbell also states that this is the best case scenario of what can happen in a world with clinical decision support. A physician survey concluded that 94% of providers were able to more easily access patient records, and 75% of physicians reported a better delivery of patient care based off of CDSS integration. CDSS allows for standardized patient care through the use of standardized physician order sets designed by evidence-based practice for an elevated standard of patient safety, from Bell and Thornton in 2011. Another 2011 synthesis of literature on the effects of CDSS on patient care was compiled by Jaspers and colleagues. This synthesis found that there is significant evidence of positive impacts of CDSS for drug ordering and reminders for preventative care for the patient. CDSS can positively affect quality of care, as there are two kinds of CDSS. One type is the system used by clinicians, and the other type is used for communication between physicians and patients. By having a CDSS that encourages patient communication, a focus is placed on patient-centered care, which is the direction that health administration is wishing to move towards in healthcare treatment. Quality of care of patients is improved when providers are able to visualize the entire pie at once, as opposed to a small piece depending on their specialty. By showcasing the entire health picture, CDSS can aid in patient diagnosis. Quality of care is also improved by the reduction of risks in patient care. CDSS reduces these risks by providing alerts and reminders, improving analysis of patient conditions, and hosting built-in safeguards to prevent unsafe and unneeded care. Without CDSS, any adverse effects prevented could have taken years to piece together on paper documentation. HealthIT.gov states that clinical decision support systems improve quality of care by ensuring screenings are performed for illnesses such as breast cancer, diabetes, chlamydia, and colorectal cancer. These system allows for an increase in services that improve patient care. These services may assist with the blood pressure monitoring in hypertensive patients and BMI testing in diabetic patients. CDSS has a positive impact on patient care, not only on paper but emotionally as well. 92% of patients were pleased that their doctor uses CDSS, and many patients have never had trouble having the prescription filled and ready for them at the pharmacy after an appointment. Additionally, through the use of CDSS, there were fewer medication errors. In 2008, preventable medical errors in the United States cost approximately $19.5 billion. Some research indicates that that's the third leading cause of death in our country. These errors are costly to companies and to patients as they require extensive medical assistance, hospital stays, and can result in litigation. CDSS worked to spark economic interest and decrease the cost of facilities by providing clinicians with alerts to a particular scenario that could result in a medical error. CDSS programs can help reduce medical errors by providing clinicians with signals to compare medications a patient is currently on, confirm the dosage, check for allergies, and verify insurance coverage for that, generic versus name brand medications. A cost reduction could also be seen by reducing the rates of avoidable admissions and redundant or unnecessary testing while decreasing the length of stay and improving quality outcomes, according to Nelson and Stagger last year. As an alternative, hospitals may be reluctant to implement certain aspects of CDSS as they result in a decrease of revenue. This is because direct benefits may be seen for patients and insurance companies, but indirectly it would affect the hospital revenue. These programs, such as the implementation of vaccination or pain programs, may produce a decrease in the number of individuals who require expensive testing, which in turn decreases profit. But this should not deter healthcare facilities from utilizing these programs, as significant cost reduction can be achieved following proper execution. The Research and Development Corporation, or the RAND Corporation, estimates the implementation of health IT programs, such as CDSS, could result in upwards of $80 billion of net annual savings. CDSS may increase the revenue by avoiding extended stays, unnecessary medication application, and enhancing quality outcomes that will improve overall ratings. Costs for patients may also decrease as prescription verification will determine if there is a generic option that can be chosen over the name brand, reduce unnecessary or repeat laboratory testing, and lower medical bills by shortening the length of stay. Insurance companies could also benefit from these services as they mitigate unnecessary billed services. The implementation and use of CDSS can benefit patients and providers positively, which in turn ensures the healthcare system is positively affected. Thank you.